And herein lies the space in which true transformation is occurring and can occur when we think about culture and capacity. In that conversation, that is the linchpin for all of the future of America's most important system.
Welcome to the Thousand Stories Podcast, the Renaissance series with Justin Brown and Luke Williams.
Hello, and welcome to the Thousand Stories Podcast, the Renaissance series. I'm Justin Brown, former Secretary of Human Services for the state of Oklahoma. When I first launched the Thousand Stories Podcast a few years ago as Secretary, it was in order to share the incredible untold stories happening in health and human services across America, the ones no one was talking about beyond the challenges and negative headlines in these huge systems. I do believe there are thousands of incredible stories that deserve to be told. Now in the Renaissance series, we're stepping into a new era of innovation and transformation, a true rebirth for health and human services, where we're moving toward a more connected, human-centered, and innovative future. Together, we'll explore how leaders, researchers, and practitioners are building systems that truly serve people, illuminating the stories and ideas that define this new era, a renaissance in health and human services. Welcome to the Thousand Stories Podcast, the Renaissance series. As always now, I'm joined by my friend Luke Williams, president of Tandem Research. Luke has been engaged in the health and human services system now for years and is a real sort of partner in crime in understanding what's happening across the country. Thanks for joining me today, Luke.
Absolutely, Justin. It's good to see you. I'm happy to be here to chat with you again.
Absolutely. Thanks again for joining. This podcast will be, I think, a little bit different. To me, the idea is sharing what I think to be sort of the reason behind this, or maybe the validation of this idea that I've been sharing around the fact that I think we're at the dawn of a public sector renaissance. I use those words quite a bit. And I sort of post about them. I talk about them. I do speaking opportunities around this idea. And you and I were talking about it this morning. And the question came up as to, what does that really mean? And should we take an opportunity to share that to build a frame for those who listen to the podcast? Because I actually do believe this entire Renaissance series that we've launched sort of should be looked at through the lens of what I think the dawn of a Renaissance looks like here in health and human services. So unfortunately for our listeners, I think a little bit of this is me just sort of sharing thoughts. So Luke, I want you to jump in where it feels right, because nobody really just wants to hear me talk. So if there's something you've seen in your world at Tandem Research, please jump in and sort of provide some context or insight and ask me questions. The key here is probing to sharpen the philosophies. And so lots of times
hey, I'll jump in and interrupt right now.
Yeah, great.
Well, no, so you love to use, these big exciting phrases like being at the dawn of a new renaissance, right? And I think, you're very good at getting the people going, but sometimes it's easy to get a little lost to what exactly that means. And I know this morning when we were talking about it, when we've talked about it in the past, you've broken it down into kind of two different almost like realms of how you see this renaissance occurring. And one is kind of higher level, it's more abstract, and one is more concrete, like how does change happen on the ground. And so I just thought before you jump in and throw a bunch of material at our listeners, I might just kind of break up the conversation, right? We're going to talk about the dawn of a new renaissance at, what we're talking two different levels, an abstract level and a concrete level. And we're calling them levers of change and then pathways to transformation. And so, Justin, I guess to interrupt you and get you rolling, what do you see as the big levers of change? If with leaders having their hands on the levers in health and human services, what can they kind of pull to really bring us into this renaissance?
So thank you for the question. Just at an initial level, I'm going to answer your question, but I'm going to rewind for a second before I go real deep in those. I do believe there are two levers for change or of change in this sort of new space in health and human services as a renaissance, and those are culture and capacity. And so we're going to talk in depth about both of those things here in just a few minutes. But as you know, I am very human centered. Our work, both on the Tandem side and the Global True North side and others, is deeply embedded in human centered design. And we are firm believers that you have to understand the perspective of those being served by the system, and that includes the workforce. By the way, the system should be serving the workforce as well. So you have to understand the perspective of those humans before really creating large scale system transformation. And so I want to talk a little bit about a specific journey. But even before I do that, one of the things that I've started to work around, and again, I've shared this a number of times. If people have thoughts or comments about this, like Justin, hey, we think you're missing this thing, or hey, that was just wrong, and here's why I see it being wrong. Like, I want to know. The intent here is to sharpen sort of all of our thoughts on health and human services transformation. So please reach out to me. The primary mechanism is on LinkedIn. I'm on there, but the idea around health and human or this sort of idea of the dawn of a renaissance in public sector really comes from a few areas. And the first is we have a set of leaders today who are battle tested through the pandemic. They have been through the worst of the worst, the biggest disruptions, really devastating impacts on communities. And now they are ready and positioned to achieve the outcomes that they came to these systems to achieve around family building and poverty elimination and those sorts of things. So there's a universe of leaders today just on fire to do the real work they came to do on offense. The second is we have this body of knowledge today that we didn't have just a decade or two ago. And constantly those things come up to me. So like we understand trauma in ways that we have never understood before. We understand the concept of social determinants like we never have. We understand, honestly, I believe we're starting to really understand that there is an opportunity to look at safety net programs as real investments in families that have a return for government and for society. If we invest dollars in families through programs, those people are no longer dependent upon systems, and they reinvest in, it's an investment in our future investment in our community. So we're understanding those sorts of things. We understand upstream prevention in ways that we have never seen before. And so anyways, like we have this body of knowledge that has been building over the last couple of decades that now we have leaders who can explore and work through. And then the last is we are like right in the early stages of technology revolution with AI and emerging technologies. And so while government is typically slow to the game in some of these, understandably so, that doesn't mean it's not here. And so I do think there will be a significant amount of influence. So that's why I say use these words around HHS and public sector renaissance today. But what I mentioned is I like to sort of embed within these conversations a real dialogue on the impact to humans, a human-centered design approach. And so I'm going to introduce to many people, although many people have heard me talk about her before, a persona named Mariana. And I want you to think about Mariana. She is a consistent face in health and human services systems across America. She is a single mom of two young children, too young for school at this point. She works two low-wage jobs, about 60 hours a week. And Mariana makes enough money to support her family through those two low-wage jobs. Of course, she regrets that she doesn't have as much time as she would like to spend with her young children. But fortunately for her, she relies upon her family for childcare as her kids, as she's working. Now, the downside to that is a recent episode has resulted in a diagnosis for her mom, who is kind of the primary childcare provider for the two kids. And her mom can no longer take care of her kids while Mariana is working. And has had sort of devastating results upon the family. And in fact, Mariana has had to make a decision, and a decision that many people face in this circumstance. And the decision is that now Mariana has had to quit one of her two jobs in order to care for her kids while when her mom was doing that prior to. And so now she does not make enough money for her to support the basic needs of her own family. And so she comes from a proud family. Again, she's worked 60 hours a week, has never asked for assistance in any way. But because of that decision, she is now walking into the Department of Human Services for the very first time, seeking assistance in the form of SNAP benefits. So that's the setting I want to provide. As she walks through the door for the very first time, she interacts with Zoe, who is the worker on the other side of the desk at the Department of Human Services. And herein lies the space in which true transformation is occurring and can occur when we think about culture and capacity. In that conversation, that is the linchpin for all of the future of America's most important system. Health and Human, it's the largest system in America. It is where government meets people, is in state and local health and human services. Between a quarter and a third of every state's population interacts with the health and human services system every single year. So that relationship, that interaction is where it is, where transformation is likely to be seen the most. And so that's when I want to take a step back. I'm not going to yet tell you what I think happens in that interaction. I'm going to land that space with our listeners for just a few minutes. So now I'd like to go into this concept of the two levers of change that you brought up to start this conversation. The two levers, and I answered your question, were culture and capacity. So what happens in that interaction between Mariana and Zoe purely depends upon the culture and the capacity of the agency with which Mariana interacts. And so many times today's culture in health and human services is built on a culture of outputs rather than outcomes. So these agencies are measured by federal, state, judicial organizations who have outputs that they require them to achieve, and that's how they're measured. So the nation's health and human services leaders believe that there is a better way for that. So in February of 2023, 2.5 years ago, I was secretary at the time. I convened a group of about a dozen health and human services leaders on a Saturday morning. It's the only time that you can get a group of a dozen HHS leaders together is on Saturday. That's a little bit of a trick. I don't do it very often, but occasionally with an important conversation, folks will come on a Saturday morning. And so we've met for 4 hours virtually. And the purpose of the conversation was to create the elements of a targeted national culture in health and human services. What are the areas that we can all agree on are important for our systems? Recognizing, of course, that every agency and state has their own sort of local interpretations, their own way they're going to implement. They're going to have their own cultural elements, and that's great. Just are there things that we can agree to as a nations, as the leaders of some of the biggest systems in America? And so we came up with 4 elements. Those 4 are: health and human services is human-centered. We are outcomes-focused. We are relationship-driven. And we are trauma-informed and hope-centered. Those are the 4 elements: human-centered, outcomes-focused, relationship-driven, trauma-informed, and hope-centered. And so those 4 elements build a culture in which Zoe, in that interaction, is not thinking about necessarily the fact that her role is of one side of a transaction.
Pause and remind the viewers real quick. Who is Zoe
Please.
In this interaction?
Zoe, yeah, great. Thank you. Mariana is the client walking in the door. Zoe is the worker who is helping her, who is the first person she interacts with the first time she asks for assistance through the form of SNAP benefits. So she is the worker who is helping Mariana to get SNAP benefits to the Department of Human Services. Thank you.
And can you kind of contrast real quick what that interaction between Zoe and Mariana might look like when the culture is output focused rather than outcomes focused? Kind of use that as a way to explain the difference.
Yeah, I think that's really important. Also, I will probably weave some concepts around capacity into answering that question, because today in health and human services agencies across America, the Zoes have roughly 800 people on their caseload. And so there is literally no capacity, regardless of the culture, for Zoe to do anything more than to look at herself as one side of a transaction, which is the output focus, right? Her goal is to get Mariana, if she's eligible, an EBT card to help her feed her family, and that's it. And leaders across America believe that if we first create the right culture and second build organizational capacity, that we can move Zoe's focus away from just that transaction of giving an EBT card to asking the next question. And that's the future that we have in mind for health and human services. And the next question begins with, of course, other basic resource needs. You know, where are you staying tonight? Like, are you at risk of your electricity being cut off? And it's, it's 95 degrees today. But then it should move towards asking questions around how are the kids? And then, of course, next is, what's your educational attainment? And if you could have another job and you didn't have to have two low wage jobs working 60 hours a week, what would that job be? Where are your passions in life? And that's what we want the Health and Human Services system to look like, to look more like caseworkers, which is why Zoe came to work for DHS to begin with, than a transactional sort of robot. That's the direction that we need to push these systems. But of course, it's because of those two levers. It's culture and capacity that keep Zoe from being able to sit in that position. So in 2023, a group of leaders created these 4 elements of a targeted national culture. And so Zoe, to the extent that culture can be ingrained within a Health and Human Services agency, what happens is you then see Zoe sitting at the desk, and when Mariana walks through the door, she doesn't look at Mariana as just a transaction. She looks at Mariana as sort of the sum of all of her potential experiences, because she is human-centered. She's thinking about the reason behind Mariana's entry, not the fact that she just needs SNAP benefits, but she lost her job, or I'm sorry, she had to quit a job to take care of her kids. Well, what about childcare, right? Childcare at its core is a workforce program. It's intended to support low-income families so that they can work and they know that there's a safe and enriching environment for their children to be in. And so she looks at Mariana as sort of the whole of all of her parts, instead of just that one transaction. She also looks at and understanding Mariana. And because of the culture of being outcomes driven, she is thinking about what success looks like for Mariana, not just what success looks like for Zoe in executing that transaction. So for Mariana, success is being able to satisfy the basic resource needs of her family, but she's also a very proud person from a proud family and doesn't want to be reliant upon government programs in order to feed her family. And so she wants a better job and just needs help getting there. And so this is this culture that allows for seeds of transformation to flourish. And so that's what we're trying to build as that first lever, pulling that lever. The second lever is capacity. I mentioned that the Zoes all across America have something like 800 people on their caseload. It depends upon the state. And, some states don't keep formal caseloads, but that's the demand based, on a sort of per state, per worker basis. And so there is no opportunity for her, even if the proper culture is set, for her to actually ask those questions, because her highest and best use is getting to the next person and helping to get benefits. However, if we are able to leverage technology to unlock human and organizational capacity, then Zoe now doesn't have 800 people. She has 8 people or 80 people, something much smaller, so that her highest and best use moves from transactional to relational. And now she can work with the complex cases, and she can help to remove barriers that exist for those who she's trying to serve to access resources, and create resource referrals, meaning a workforce program, a job interaction, like those sorts of things, because now she has the open capacity to be able to do so. So that's where I think that we have an opportunity to unlock capacity through technology.
I do want to suggest really fast. I mean, when you and I have spoken about this in the past, so the way that you just spoke about capacity, or perhaps let's thinking about culture first. I find that it's really helpful to think about culture, how you put it, where what is the next question, right? What is the next question that an employee or a staff member of HHS might ask? And that's very clear that, whatever that next question might be, which currently is, how do I get to the next person on my caseload? If the next question is something, how do I get her childcare subsidies? And then how do I get her in a better job? That changes things quite a bit. So that piece is clear to me. But when we've spoken about capacity in the past, Justin, the way you just described it was kind of unlocking potential energy, right? That is already there, right? It's taking what's there and kind of giving that room to go where it's most needed. But there's another part of capacity that I think that you've spoken about quite a bit in the past, and this will lead us to kind of the pathways to transformation. But capacity, I mean, that word also means capability, right? It's capacity can also mean giving new tools, new powers, just new ways of approaching problems in cases. So it's not only unlocking potential energy, it's also, bringing in new abilities, right?
Absolutely. It's the skill set necessary to move from transactions to relationships. People may have the culture, but not the know-how to do that. And the key there is what I believe to be these pathways to transformation. So we've talked about the two cultural elements, but you're right that sort of in my vision, there are four sort of pathways to transformation that really are mostly about unlocking that organizational capacity. And you're right, the capabilities within the agency in order to upskill people into true case management. So whether they have the desire to is one thing, that's culture, but the capability to do so is another thing, and that's around capacity. So there are four elements or four pathways to transformation that I think is important to lay out. The first is delivery model transformation. So it's not necessarily the programs that we offer and the functionality of those programs, thinking SNAP benefits and TANF and those like the weeds of the policy, but it really is how we get those resources to people when and where they need them. That gives us an opportunity to meet people before they become in crisis, and to streamline delivery into a much more efficient process that can look like the physical delivery model, which I talk a whole bunch about. And we actually did our most recent podcast on physical delivery model innovations. So those are examples of this pathway to transformation: is physical delivery model transformation and digital delivery model transformation, which we talked about on the last podcast that I'll refer our listeners to.
Right. No, it just strikes me. I mean, I think it's a little bit vague to talk about capacity being a lever of transformation, but it's easier to understand if we think maybe Mariana lives in a very rural community, right? And maybe she doesn't have a car, and to even get to that interaction with Zoe, that might be a challenge, right? And that's I think this is a very clear way where capacity becomes a lever of transformation, because let's say the state HHS agency has mobile SNAP delivery, right? That goes out to rural communities every day, right? And so that interaction with Zoe might only be possible for Zoe because there's capacity to bring the van out into her community. You know what I mean?
Yeah, I do. That's really interesting. And you brought another thing to mind for me. It's not just unlocking capacity within the agency, but by removing barriers for Mariana herself, we're unlocking her own capacity, own capacity. So you're right. If she lives in rural America without transportation, she does not have the capability to get from where she is to that office to have that interaction. And so how do we think about creating a more efficient delivery model that unlocks Zoe and the agency's capacity to reach her, but also her own capacity to reach and serve herself? And that's a really important point. Thank you for that. The second pathway to transformation that we've already sort of talked about a lot is culture modernization. I think you really have to go deep into HHS culture, again, to build this sort of landscape for seeds of transformation to flourish. We see lots of times projects stalling or being rejected completely, even after completion, because the culture is not there that allows for people to be focused on the outcomes first and the way of doing things, regardless of whether it's the way it's always been done or a new way, to be the best way to achieve those outcomes. And so that culture component is critically important. The next piece is a bit of a new concept that I don't know that I've talked much about on podcasts before, even in the initial launch of the Thousand Stories podcast, but it's all around shared capacity. And so sharing capacity is a vision that came to me, or a concept that came to me I don't remember the exact year, 2021, 2022, somewhere in that time. And a sister state of Oklahoma, Louisiana, had a huge tornado. And hurricane, a huge hurricane. I'm projecting our tornado issues in Oklahoma onto Louisiana, but they had a huge hurricane, and it wasn't necessarily an overwhelmingly devastating hurricane like some of the hurricanes have been down there. It was, when I say huge, it is just the geographic scale of the hurricane. It impacted 27 parishes. And the agency had to deliver disaster SNAP in a much expanded role. And honestly, a role and a geographic area that they had really not had to deliver DSNAP in before. And so I happened to be talking to the then secretary at the time, who was a friend, and she said, she sort of explained this issue, and she was really more just, kind of help, asking for my guidance on or sort of partnership and thinking through this process. And I thought, well, I mean, maybe we could take some of our merit protected employees who do SNAP and disaster SNAP and deploy them to this disaster in a really quick fashion and help you all do DSNAP in Louisiana. And so we decided to try it. And so in Oklahoma, we deployed something like 150 eligibility workers to help do disaster SNAP for Louisiana in response to this hurricane. We plugged into their technology. We plugged into their call centers. They had some pretty good technology at the time that allowed for remote access to it. And within a matter of a handful of days, we had these 150 eligibility workers doing disaster SNAP for the state of Louisiana. It was a really powerful experience. The state of Texas also joined into us, and so they had a number of people. I don't remember it was how many people they deployed, but the example that it laid out for me was that in this system at that time there was some excess capacity in one part of the country, meaning Oklahoma and Texas. And we were able to take that capacity and satisfy demand in another part of the country. And so that's where this concept for system transformation comes, and this area of this pathways for transformation comes to me around shared capacity, is that we should be able to mine capacity in some places to share it with other places. Maybe it's at the agency to agency level within a state. Maybe it's division by division. And I have an example of that I'll share. Maybe there's private sector capacity that could be mined. Of course, efficiency and proper fiduciary of taxpayer dollars is super important. And you have to be mindful of that when you talk about private sector alignment. But there is capacity that needs to be deployed in certain of these really important spaces. The example that I have around division to division, early stage pandemic, this would have been, I don't know, maybe May of 2020. In the Department of Human Services in Oklahoma, we had been sharing our True North principles across divisions. And so each division knew the real sort of personal goals of the other divisions. And as we were projecting what our budget shortfall would be in that budget cycle from the pandemic, we didn't know what it was going to be. And so we started to work division by division. And our child welfare division knew that the developmental disabilities division had a goal of eliminating the developmental disability wait list. Like, this is a tragic wait list. It was a 13-year wait for services in the state of Oklahoma if you had a child born with a developmental disability. And so the child welfare division harvested a few of their positions, which, if you've been in government budgeting and operations, positions are gold. Like, you do not let go of positions. But child welfare knew that DDS wanted to achieve this goal. And in this budget scarcity cycle, they harvested a handful of, I don't remember how many positions it was, but in order to ensure to protect the developmental disability services team so that they could achieve their goal of eliminating the DD waitlist. Again, another example of capacity existing somewhere where there was demand in another place. And so that shared capacity, I think, is a really important philosophy to think about over time. And then, of course, the fourth pathway for transformation is technology modernization. I have hundreds of stories about technology in government. Many of us know, if you're a listener who's not deep in government, many, if not most, of these systems operate on 40 to 50-year-old COBOL mainframe systems. These are green screen, no mouse sorts of systems with 900 screens that you have to remember the 4-letter code to navigate from screen to screen. Technology that is absolutely older than I am. And, we're training 20-year-old employees fresh out of social work school on 50-year-old technology. And so the concept of technology modernization is critical. Legacy tech uplift, super important. But more than anything, in my opinion, as we're building big legacy system modernization opportunities, The need for small, lightweight technology implementations to deliver value today to citizens and to agencies is critically important. I think that there are probably dozens, if not hundreds, of very small implementations that cost very little, that could be deployed in government agencies. And because of the size and scale of these agencies, the impact is dramatic compared to the expense and the effort associated with developing these tools. So, technology modernization is the fourth. So, in order to summarize for the audience, four pathways to transformation in my mind. First, delivery model transformation. Second is HHS workforce culture modernization. Third is shared capacity, and fourth is technology modernization. So those are the four areas. So I know we are at the end of our time. I told you at the beginning of this that it would be a lot of me talking. So Luke and audience, I apologize for all the words today. Any parting thoughts or anything you would like to add?
Well, I would like to ask you, so we pursue these four pathways of transformation. What's different about the interaction between Mariana and Zoe? Finish the story.
So I love that. Thank you for prompting to finish to that story. So I sort of alluded to it a little bit, but as Mariana walks in, today she feels shame and stigma and embarrassment associated with her desire, or her need, not desire, her need to ask for support. We have forced her to fall to this level of despair to reach out for help. I think in a future Health and Human Services system, first of all, in the event she does come into the office, Mariana is met with a different approach. The culture exists to think about her whole person. Zoe has, instead of 800 people on her caseload, she has 80. So today she treats Mariana as one side of a transaction. In the future, she's building relationship and asking all the next questions, connecting her to resources that promote upward mobility and resolving barriers for her. I also think one of the areas of shared capacity that we didn't talk about was and delivery model transformation, both is community integration. So it's working with community-based organizations to deliver resources. I'll end with a story. This is a good one. I'm so glad you asked this, Luke. So here's the story for you. And this should illustrate some delivery model transformation efforts, as well as shared capacity, and answer your question as to what the future could and should look like. In Tulsa, Oklahoma, we being the Department of Human Services, had a huge building. So it was a second state office. It was a couple 100,000 square feet. It was just massive. And it hadn't been touched since like the early 90s. I call it a dinosaur building. I mean, it was gross. Every time I walked into the office and I walked into the waiting room for benefits, where people were waiting to apply for SNAP benefits, there were 70 to 100 people lining the outside of the walls. And it was oppressive in its feeling, just terrible. And, kids crying and the whole thing. And so we embarked upon delivery model transformation. So we ended up building or acquiring a new space in downtown Tulsa that was 3,000 square feet. And that space was what I at the time referred to as a retail office. It was essentially for benefits delivery only. So those folks who were doing that work in that lobby were doing that there. But at the same time, we also started building our embedded worker strategy in downtown Tulsa around our community integration approach. And so we had workers in other spaces downtown Tulsa. And so I remember we closed this big building, and I remember going to this smaller space in by the way, a much more high traffic area near the bus stop, near the courthouse, and walking around talking to the workers there. And it looks like an Apple Genius bar. It's dignifying. It's a place that really illustrates the value that we have in the people that we serve, or that we place in the people that we serve and the people who work in the agency. And I remember it occurred to me like 45 minutes into the conversation that I had not seen a single human being as a client walk into that space. And so I said to the young lady behind the sort of welcome counter, if this were the other building, I'd have seen 75 to 100 people already. What's happening? Where is everybody? And she said, Justin, I think we don't get anywhere near the traffic, and I think it's because we have 12 embedded workers within a mile of this location. So we are meeting people where this sort of phrase where they are, and we are meeting them in the courthouse, in the homeless shelter, in the infant services organization. And so they don't fall to this level of despair to reach out to us for help. They are already going to a trusted partner where we have a presence and we're serving them there. So the answer to your question and what happens to that interaction is, if it does happen in an office, a DHS office, it is a much more trauma-informed approach. It's a whole person approach with its real caseworker sort of style. But those interactions are actually now happening in a more dispersed format. They're happening in community-based organizations, in schools, where our clients already are, where they have trust-filled relationships. And of course, there's a lot more self-service. People are able to do things online, and that and through contact centers, and that unlocks organizational and human capacity to allow for the time necessary to do casework again. So that's the future, I think. And I would love anybody who's listening and thinking, like a lot of that resonates, but here's what you're missing, or here's my idea on how this looks. I would love for somebody to reach out, via LinkedIn and just share their thoughts. It's a really powerful opportunity to sit with community and think about the future of America's most important system. So with that, we will wrap it up for the Renaissance series, this second episode of the 1,000 Stories podcast. Luke, as always, thanks for joining me. Next time, I will give you more opportunity to speak.
No worries. Thanks for joining me, Justin. We'll see you later.
All right. Thanks, everyone.